There are many different ways in obtaining a skinfold measurement. You can use a skinfold caliper, which uses the fold of the skin, a bioimpedance, which sends an electrical current detecting lean tissue comparative to body fat tissue, or you can use hydrostatic weighing, which is a mass per unit volume of the person's body. Today, we will be using a skinfold caliper.
A skinfold caliper is a device that pinches the skin, measuring the separation, calculating the thickness of the skin. The skin thickness measures the fat beneath the skin based on anatomical sites. First, before getting measurements, the skin must be dry at the surface to maximize validity and reliability. Grasp the skin firmly with your thumb and index finger to form a fold in the skin, subcutaneous fat. Place the skinfold caliper 0.5 centimeters to 1 centimeter from thumb and index finger. Once the skinfold caliper measures the thickness of each anatomical site, to increase validity, the individual obtaining the measurements should take 2 or more measurements at each site until readings are closely related.
The procedure in obtaining a skinfold measurement with a skinfold caliper is made on the right side of the body with the patient standing upright. The caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and finger, perpendicular to the skinfold, and halfway between the crest and the base of the fold. Pinch should be maintained while reading the caliper. Wait 1 to 2 seconds before reading the caliper. Rotate through measurement sites or allow time for skin to regain normal texture and thickness. Take duplicate measures at each site and retest if duplicate measures are not within 1 to 2 millimeters. In order to use a skinfold caliper to attain someone's body fat percentage, you must find a lab that has the space and equipment necessary for your assessment, much like the Morehead States lab here in Laughlin. First, you will need a data sheet to collect all the measurements you are making with your caliper. You will need a caliper that is calibrated for your measurements, and a specific equation to calculate body fat percentage. A common error within the skinfold measurement is the direct measurement does not determine the individual's body fat percentage. It's the calculation of these measurements in a specific equation. Some special considerations of this skinfold caliper test include the determination of the effect this test will have on your individual being assessed. Some questions you may ask is, does this individual feel uncomfortable? Are there any injuries that limit our test? And what activities has your individual participated in that may harm or skew the results? Overall, the goal of a skinfold caliper test is to track one's performance by the measurements of lean muscle tissue comparative to subcutaneous fat. There are many different equations when obtaining a skinfold measurement. One of which we will be using today is a 3-site formula, including the chest, the abdomen, and the thigh. The chest is a diagonal fold in men, which is 1/2 the distance between the anterior auxiliary line and the nipple, and in women, which is 1/3 of the distance between the auxiliary line and the nipple. The second site is the abdomen. The abdomen is a vertical fold which is 2 centimeters to the right of the umbilicus. The last site of the 3-site formula is the thigh. The thigh is a vertical fold on the anterior middle line of the thigh, midway between the proximal border of the patella and the inguinal crease, which is the hip. Using this 3-site formula, including your age and the 3 sums of the skinfold sites, can approximate your body fat percentage. Hopefully, this video tutorial has taught you how to properly use a skinfold caliper. Although there are many different equations out there to detect body fat percentage with a skinfold caliper, the procedures are the same.